Alrighty, so welcome to the information session for the Masters of Science in Health in the Public Interest program here at Georgetown University. We're really thrilled to have you here, and we'll jump right into what we're going to talk about today. So first, we'll introduce ourselves and our roles within the program. We'll talk about the program itself, what makes a happy degree a bit unique from the traditional MPH, talk about career opportunities and alumni outcomes featuring our very special guest, Sarah Hoover, who is an alum of the program. We'll go into a brief admissions overview, what to expect when applying to the program, and finally leave plenty of time for all of your questions. So first of all, my name is Jennifer Jansen. I use she, her pronouns, and I am the program coordinator for the Health in the Public Interest program. What that means is I act as an advocate and someone who offers resources and assistance to students who are prospective thinking about the degree, students who are enrolled in the degree, and alumni. So we really try to kind of help you smoothly transition both in and out of the degree and really train public health leaders. And I'm a great resource for any kind of additional resources you're looking for through Georgetown or questions you have about the program. I'll introduce for you our co-directors of the program, which are Dr. Adam Myers and Dr. Adrian Fu-Berman. First, I'll pass it off to Dr. Myers to introduce himself and talk a little bit more about his expertise.
Hi, good morning. Glad to have you here. We're going to be presenting to you about the Health in the Public Interest Program, which is my main interest academically these days, although I started out as a cardiovascular physiologist at Georgetown University Medical School, where I did medical school teaching and research. And maybe over the last 15 or 20 years or so, I've gotten more interested in interdisciplinary programs and programs that um, kind of address social needs. And that's why I got involved with Dr. Fu Berman in developing this program, which basically, as you'll see, looks at the intersection between society and health. So, Adrian?
Hi, everyone. Good morning. Thanks for joining us. Yeah, I'm co-director of Farmed Out. I'm in the co-director of the Happy program and also director of Farmed Out, which does research and education on how the pharmaceutical industry manipulates prescribing habits. I know at least one of you's interested in that issue. I'm in the departments of pharmacology and physiology and also the Department of Family Medicine. Um, we've been running the Happy program now for so we'll be entering our 8th year. So I can't believe it's been that long. But really looking forward to answering any questions you have.
All right, and I don't have a picture for her, but I'd also love to give Sarah Hoover a moment to introduce herself and her relationship with the program.
Hi, I'm Sarah Hoover. So I just graduated this past cycle from the program. I was a biology major prior to coming to the Happy program, but I really like when I was doing like my master's degree search, like loved the interdisciplinary curriculum that it laid out. And I was more than pleased and I'm more than behind like the program and like can say it's like invaluable. So really hope y'all also like it and maybe apply. But yeah, so just a recent graduate.
All right, wonderful. Now I'll pass it back off to the co-directors to introduce some of our faculty.
So, I don't know if Adrian wants to take this. Do you want me to take this part, Adrian?
I'll do it. Yulia Chensova Dutton directs the fabulous summer course that we start with. So the summer course is virtual. It's in August. It's 3 weeks long. It's very intense, and that's sort of our boot camp for social sciences. So it's taught by Yulia Dutton's a cultural psychologist, and it's also taught by an anthropologist and what's the third one? Actually, Tony Shelley's not going to be teaching this year. We're going to have a new teacher for epidemiology, um, uh, it's for theory and methods of epidemiology. Lynette Golding is this fabulous person who works for Save the Children, and she does this really great health communications class next. And Pam Saunders does the second part of our research methods course. So the first part is more quantitative in the fall, and then more qualitative in the spring. Pam's a linguist and very experienced in qualitative measures. Sarah Knight Marver teaches our biology and health and disease course, which not everyone takes. If you have a degree in biology like Sarah did, you don't have to take the course, but we get students who have a humanities degree, for example, and haven't taken any biology, and we need them to understand disease processes and be able to follow the lingo on things and understand some basic anatomy, physiology, etc. So Dr. Marver teaches that, and Dr. Turbat is a French economist who teaches our health economics course next. Dr. Sherman teaches one of the electives. He teaches nutrition courses, and Max Weinstein does is a demographer who does global health courses. I think passing on to you, Adam.
Okay, thank you. So Georgetown's really a wonderful place to go to school if you haven't visited our campus, and there are opportunities to do that if you wish. You'll probably hear more about that later. But at Georgetown, you really engage with a broad community of students and faculties and alumni who come from all over. And in this program, you'll meet people from a variety of academic backgrounds and experiences. And the courses are really designed to blend sort of the academic world with the real world of employment and on-the-ground healthcare. And so it's a great place for you to take the next step from your undergraduate education into something that has practical and wide-ranging relevance to one of the major problems of the world, and that is the disparities and problems in the healthcare world. So you'll have opportunities to apply what you learned while you're in the program by doing projects, meeting people, moderating seminars, etc. And then you'll hear about the capstone later on, where you'll put everything to good use in doing a project or some kind of experience that takes you into the more closer to the employment world. So Georgetown is a Catholic university. It's rooted in the Jesuit order's value system, which strongly supports education and care of people. It's not a, quote, religious school, unquote, but it's one that has a value system inherent in what we do. It doesn't affect what we teach, and it really affects how we teach it and how we look to apply our teachings to society. Next. Okay, so I'm going to talk about why happy and then the curriculum a little bit, and then I'll pass it back to Dr. Fu Berman. The Health in the Public Interest Program is a program that looks at all of the factors besides clinical factors that affect the health and healthcare of our population. We look at the intersection between corporate and institutional influences through a curriculum that emphasizes critical thinking, analytic thinking, and also research skills. It challenges what we face today. It challenges how we look at the world, and the problems in the world today really require creative and interdisciplinary solutions. And so we truly embrace that interdisciplinary approach. The curriculum has a number of core courses. It's a little different from many master's programs in that you have room to tailor your curriculum, and as you'll see as we go. But this is a list of our core courses. You've heard about most of them. Dr. Furberman will tell you a little bit more in a moment about health advocacy, a key course in the program. And then the theory and methods courses are basically quantitative and non-quantitative research methods applicable to study of health. And then the health communication course that Lynette Golding teaches that was mentioned. Next, please. So a program interview, basically our program takes a year to complete. It starts at the beginning of August and ends in July of the next summer, usually. Depends on how long your capstone takes to finish. We enroll both full-time and part-time students. The part-time option takes 2 years. Most students are in it full-time, which is, as I said, it's from August 1st until the next July. It includes a seminar series in addition to the courses. That's one of my main roles in the program. We bring really experts in areas of public health and related fields to address students and a wider audience virtually. It's a very interactive session. We do it virtually. It's kind of a remnant of COVID when we learned that yes, most things are better done in person, but some things are better done digitally. And the seminar was one of the latter things. We found that we could get great speakers, people like Anthony Fauci and others. You'll see some of these later, and who might not be able to come if it was in person. And not only that, but we could get all kinds of experts coming just to listen to our seminars. And so it gives students a chance to interact with some of the great people in public health and related topics, and also to start networking with some of those people. The total tuition for the next year is $62,940. That's a lot of money, we know, but you'll hear later from Jennifer about how you can finance that tuition. But we do have opportunities for merit aid and student loans, etc. If you're going part-time, you're charged on a per credit basis, but the whole degree costs the same amount. Next slide, please. Okay, so this is a standard full-time schedule. You've heard some of this already. You start virtually in August. It's considered part of the fall semester, although other things haven't gotten rolling yet at that point. And then we come in person to study theory and methods part one, which is some epidemiology, biostats, the biology of health and disease. This is can be exempted out of, as Dr. Furberman mentioned, and it's an opportunity to tailor your education to what you want to study. If you don't need to take biology of health and disease, perhaps you can take a course in women's health or some other topic that you're specifically interested in. Seminar and one credit for seminar, and usually 3 credits for another elective. So 2 electives in the first semester rounds out that session. And health advocacy, I forgot to mention. So Adrian, how about if you talk a little bit about health advocacy here and carry on for a while?
Sure. So health advocacy is one of our core courses, and it's very immersive, and students attend advocacy events and assess them. They write op-eds. They do a group project where they actually implement an advocacy event, which is very scary to some people, but often turns out well. Sometimes it's a complete disaster, but it's always a learning experience. And DC is a really great place to be learning about and doing advocacy. So I like to think it's a fun course. I don't know, Sarah, was it a fun course?
Yeah, so actually on the little run of show, it was like talk about your favorite class. I was like, I don't want to come off as a brown noser and say health advocacy because you taught it, but it was my favorite class. It is very, very hands-on. And you like go to different events and do write-ups on them. But for me personally too, it also like acted like as a segue for me to start working with Planned Parenthood because I went to some of their events for the class, but it's also something I care about. So then like sometimes like that type of stuff comes out of it. So yes, I really like the health advocacy class.
Oh, thank you. Next slide. I think we already covered this, no?
This is just the part-time schedule for the program, kind of a
Oh, I
sample of
see.
what it might look like.
Oh,
And
you're
also
doing it.
Sarah's welcome to speak on her experience because she was a part-time student.
Right now? Is that
Sure.
Yeah,
okay?
yeah.
So yeah, I did do the program part-time because I worked a couple of odd but adjacent jobs like while I was in the program. One of them was at a healthcare communications firm. So if anyone wants to write it down, Reservoir Communications Group in Washington, D.C. is a healthcare communications firm that has what are they called? Internships for students that are at like GW, Georgetown, Catholic University. That's like a part-time internship, like while you're in school. So I did like a part-time internship and like part-time school, if that makes sense, for like most of while I was in the program. And that worked really well for me. And I really, really like enjoyed that because it was like, okay, I'm learning all these concepts in class while simultaneously applying them and like just like how my brain works like that kind of like tangible like learning experience and like application like worked really well for me. um it's again it's just depending on like how long you want to spend because it did take me 2.5 years to complete the program as opposed to one. Because maybe if you're like a real powerhouse, like you could, have an internship and do the program full time. But like you'd really have to you'd really have to know your stuff to do that. But so that's what I did. But on the flip, and something I didn't consider before deciding to do the program part-time is your cohort who all do full-time together, like gets really close. And I was fortunate where I got to kind of like meet people from both cohorts. And I met double the number of like really cool people. However, I didn't feel like I like was quite as like close knit, which was like something um that like just I mean, I just wasn't quite around as often. But everyone I did meet over the span of the 2.5 years was amazing. And I'm still in touch with some of them. And some of them are still in DC. Some have, gone away to other places. But that was just how I approached it.
Did
Um,
you feel closer to the group you started with or the group you finished with?
the group I finished with.
Hmm,
Yeah, because it was
interesting.
like I graduated with them. So yes, yeah, it was like the group I finished with. So, and I did like slightly more classes, I think, with that group. But there were a couple, I think, was it like Jasmine maybe, who was kind of like me, Jasmine and like Hallie. So like they were also part-time. So then I had a couple of part-time students that were like dragged along with me. So there was a couple of people that were like, okay, well, we've been together for a while because you're also here for 2 years instead of one.
Hmm.
But yeah, so that worked really well for me. So I guess it just depends on like the approach you want to take, how much time. Um, you want to spend DC or just like as a master's student, but like the 1 year program, whether that be over the span of one or two, was like a perfect amount of time.
Thanks so much for sharing. And if
Yeah.
you have any other questions about being part-time or full-time, what that might look like, you're always welcome to reach out to me. I'll put up our contact cards at the end of the presentation. Typically, people like Sarah complete in 2 to 3 years if they're part-time.
Next. And so Sarah mentioned like doing electives, and these are just a sample. Students do electives all over the school, occasionally even in the law school or another school. You can't do it in the med school, but occasionally students will do a law class. So we have a list of approved electives, but students are always welcome to submit something. And it either has to be health related or you have to make an argument that it's health related. Then we determine whether it's okay. But what's great about the electives is students can concentrate in a particular area if they want. So you've taken the core courses, but one of the things that's different about our program and then say an MPH program is you have more leeway to take courses that are in your area of interest and sort of do a concentration in that if you want. Next.
So hang on a second. So Sarah, can you tell us what electives you took?
Yes, so I took international right to health law, which I think I was like the first person to like take that one in particular because I like really wanted to take one of like the classes through Georgetown Law School that was like available. And I found it really, really interesting. So that was like at like the actual law school and also some of their law classes. It was like a weekend class where you went for like 6 weekends, but it was from like 9 a.m. to 4 p.m. on Saturday and Sundays. Um, and that covered kind of like it was very interesting because I felt like some of it was like intellectual property rights of like pharma and like biomedical innovation, which is like okay, like well, like farmed out. So that kind of was like an interesting thing to learn about. And then some of it was like patient advocacy. So what are patients' rights within different like under different hospital admins or within different health systems. Abortion was a big topic. So I actually wrote my final paper on abortion as a First Amendment issue, which it is. That was a smaller, I guess, chunk of the class. But like I thought it was very particularly salient in like where we are now. And then we also covered like HIV, AIDS, PrEP, so different preventative care measures that I don't want to say are associated with like historically marginalized or like LGBTQ populations, but like the different court cases that have come out of covering these things via like different insurance policies and the different like legal challenges they've faced over the years. So very, very interesting, comprehensive course. And then my other one was War on Drugs. So another class that I think historically contextualized um a lot of different things. That one was Consequences and Alternatives. So it started with like the Nixon era, and kind of his like initiation of the war on drugs and then the different policy avenues that have been taken to kind of mitigate the risk of different drug related crises, including not limited to the opioid crisis. So that was my other one.
And then another really important part of the program is the capstone project, and that can really vary. So some students have done an internship, so more of a job kind of capstone. Other students have um, joined a research lab and done that. Some students have done independent projects. We've had students like write book proposals for books they were planning, for example, with a mentor. Some students have created educational modules for nonprofit organizations. Some students have gone to work for nonprofit organizations. So these are just some examples of some of the capstones that students have done both at Georgetown and at other places. Next. And then these are some others. So nonprofit, government, business. Sarah, do you want to say a word about your capstone?
Yes. So I did my capstone at the NIH. I was under, so they have different like institutes. There's like the NIH, and then they all have like little different institutes. And so I was in the minority health and health disparities, I guess like division. And what I did was I didn't work in a wet lab or like with like a lot of people. I just worked like within my lab itself because I worked with electronic health records, socioeconomic data, and then survey response data. And we were looking at type 2 diabetes disparities among different patient populations, um, which I found to be very interesting. So the database we worked with was all of us. So I was kind of like I don't want to say like repeating a project that had been done, but with a new database. But I was repeating a project that had been done within the UK Biobank on this biobank instead. Um, and so we did find like type 2 diabetes risk, disparities by like self-identified racial or ethnic group, and then also by socioeconomic status, which wasn't to be expected, or I mean, which is not to be unexpected, but being able to present it and say like there is like a known disparity, like here's the data, like kind of at least in somewhat produces evidence where it's like we need to like have like community-based interventions or preventative measures or healthy food, nutrition, whatever, to kind of like mitigate some of that, because data is good if done within the right frameworks. So yes, and just a note on the NIH, if you try to do a capstone there, I technically did mine through the summer internship program. So you would have to find a mentor and then apply through the SIP. Because the NIH has all these different like programs and like things you can apply for. And that was how I did mine, was through the NIH summer internship program, which is like a 3-month chunk. And so it was almost like a perfect. And I was very explicit. I was like, I need to do a capstone. It has to be like a defined project. I need to have like a mentor who can like sign off on my, my paperwork and all that. So if you're like open and kind of tell them what you are and kind of tell them like, hi, I'm a Georgetown Happy student. This is what we are. This is what we've learned. This is like what I want to do. There's a lot of people at the NIH. I say a lot, but like they have like a lot of people to talk to you and kind of help you navigate some of that. But you would also want to if that's a trajectory you want to go, you'd need like probably like 3 to 4 months time to like line it up, if that makes sense.
Great. Next. Adam, you want to talk about the seminar? Wait, you're on mute.
You got me. Okay, so seminars are on Wednesdays during the academic year. You're welcome to start attending anytime you want. We have a great set of speakers. You see a couple of them here, but well-known people, almost all of them, and people who are doing important things. It's the highlight of the program, as far as I'm concerned, of the week, because it brings everyone together and allows them to interact with an expert in some area. It's an opportunity for students to participate in a number of ways. Students can suggest speakers. Students can moderate talks. Everybody's required to do that. Then we have an online discussion afterwards. And so it's an opportunity to further tailor your education. What talks are you going to moderate? Get to know somebody who does something similar to what you want to do one day, or suggest a speaker. And that way you're networking, not just listening, and interacting with people in the field.
And these talks are open to the public, so a lot of people come. Like yesterday, we had 60 or 70 people come. It was on weight loss drugs, so it was a really popular topic. So students get to moderate something that actually involves the public as well, and so you get to learn important skills.
Yep, thanks. Next slide, please. So, who's going to cover this one?
I can do this. So,
Okay.
we have a diverse group of students who come into the program, and I think a lot of students don't really know exactly what they want to do when they come into the program. Like they're interested in health, they're interested in policy, they're interested in change, but they don't know exactly what they want to do. And it's great to watch them become more solidified in what they want to do over the year. And that can be in a variety of different directions. So some students, like Sarah, choose to go on to more school. So we've had students go into medical school, law school, or PhD programs. One student actually decided, got really set on becoming a social worker and went and got a social work degree afterward. But a lot of our students go to work in government or go to work in non-governmental organizations. So these are some of the places that students have gotten full-time jobs at afterward. Next.
And Sarah, do you want to talk a little bit about your
Mm.
path and your program?
Oh,
Yeah.
yeah. So I stayed at the NIH for I basically just did my capstone project and then like reapplied. Um and so I've been at the NIH since I graduated. And like Dr. Hugh Berman said, I also was applying to PhD programs and I got into one, which I'm very excited about. So I'll be getting my PhD in comparative biomedicine with an infectious disease concentration. Like I said, I was biology, and I'm so incredibly grateful for like the, I guess, increased ability to not only like advocate for, but communicate the value of like scientific, products. So it's like I kind of want to go into like vaccine creation, infectious disease type stuff, taking it back to biology. But we'll be able to like communicate it and advocate for it better, I think, a lot more holistically than I would have been able to without the more nuanced perspective.
Thanks so
Great.
much for sharing. Alrighty, so now I'll talk a little bit about the admissions process and what to expect when applying to the program. So here's a handy application checklist of all the materials we need from you to consider your application complete. So feel free to take a screenshot or a photo if that helps you to have it later. First of all, of course, you'll need your completed application form. This is all handled through an online portal. There's an Apply Now button on our website, and also the traditional Georgetown Graduate School portal works because you select your program of interest there. We require your application fee, which is $90. We typically have a priority deadline with fee waivers for all applicants until January 15th. That has passed, but if you were impacted by the federal workforce reduction, feel free to reach out to us because you may be eligible for a fee waiver in that circumstance. We also require the statement of purpose. This one's more academic. You have between 300 to 600 words to talk a little bit more about your academic journey, what brought you to apply to this program, and what you hope to get out of it. That's really just a great way for us to get to kind of know you and your goals and what you want to do with this work. Like Dr. Fu Berman mentioned earlier, you don't need to have a very specific path, but we do just want to learn about your passions and why public health at large. Next up, because again, we have a small cohort, we usually don't have more than 15 students. We really want to get to know applicants and how they're going to fit into our next class and become amazing advocates for public health. So for that reason, we do really recommend doing the optional statement on personal background and diversity, because this gives you just an extra chance to elaborate on anything you feel like wasn't sort of adequately shown in your application, anything in your background that makes you especially interested in public health, and really anything you want to elaborate on. It's just an extra chance for us to get to know you, and it's only another 300 to 600 words. So we'd really do like reading those statements and really recommend that you fill out one of those because it also gives us a chance to see how you'll be an active contributor in our community, which is something we really value. Next up, we require a writing sample from you. This is just 1 page or more. Typically, people submit something like their undergraduate capstone, a professional paper, or an op-ed that they wrote, maybe something you wrote at work. This is really just assessing your ability to kind of write and critically think at the graduate level. So it doesn't need to be related to a very specific topic in public health. Sometimes we've even received English papers, and that's been fine, although, of course, we do love to see your passions in public health. Next up will be your resume or your curriculum vitae, and 3 letters of recommendation. The good thing to know with this is we will consider your application complete if you submit the names and emails of your recommenders by the application deadline of April 1st. Your recommenders have a week or 2 after that deadline to submit their letters to us because they do that directly through the portal. They should get an email once you fill out their information with instructions on how to do so, but you're also welcome to check the status and send them reminders through the application portal. Next up is your unofficial transcripts. Same thing goes here. We do want to see transcripts from any sort of study you did, including if you maybe took classes at a community college before you went to undergrad, for example. But kind of same deal as the recommenders, where we'll accept unofficial transcripts as a complete application to review, but we will eventually need your official transcripts ordered once we make a decision, so that the graduate school can have that on their records and just make sure everything checks out. Another good thing to know if you're coming straight from your undergraduate study is when you're ordering an official transcript, make sure it shows that you completed your undergraduate degree, because sometimes people order them too early and it can cause some confusion. Finally, if you are a non-native English speaker and you studied undergrad at a school whose primary language of instruction was not English, we require a demonstration of English language proficiency test. This can be in the form of a TOEFL or an IELTS test. You can see on the right the minimum scores required there to be eligible for admission. If you did, however, attend a school where the primary language of instruction was English, you are absolutely fine and you don't need to submit that. You'll also see in the other blue box on the right that we do not require any GRE scores. All right, so to elaborate a little bit on me mentioning eligibility, what does it mean to be considered eligible for the program and admission to the program? First of all, applicants must hold a bachelor's degree or equivalent from an accredited institution. So this would translate to a 4-year degree of undergraduate United States study. If you are an international student and you're not sure if your degree is equivalent to that, we really recommend submitting a WES evaluation. You can also reach out to me if you want to know other types of evaluation credential services we accept, but WES is the preferred provider for Georgetown because they'll let us know right away if your degree translates to a 4-year degree of undergraduate U.S. study. Next up, again, as we said, we're very passionate here about what we do, and we really want to bring it into the classroom, but also the real world. So we really love to see demonstrated interest in public health related fields such as healthcare, health equity, reform, and especially advocacy. All of that strongly prefer, and anyway, your volunteering time, your internship time, any classes or experiences you had, all of that we love to see, and all of that you're welcome to include in your application materials. Finally, the Graduate School of Arts and Sciences requires a minimum grade point average of 3.0 on a 4.0 scale. But I do want to draw your attention to that blue box in the corner because we do conduct a holistic review of applications. We understand that everyone has a different sort of educational journey, and if you feel like you are concerned by this requirement, but however feel like you're otherwise a very compelling applicant, you're welcome to reach out to us, and we can kind of see what we can do on our end. If we think that you're a very compelling applicant, but you don't quite meet one of these requirements, we are able to make an appeal to the graduate school. So make sure to reach out to me for more information on that if that's something you are curious about. Finally, here are the application deadlines. Our priority deadline has passed for this cycle, but our regular deadline is still going. We are reviewing applications on a rolling basis until April 1st of this year. It's hard to believe that's coming up so soon. But also be sure to ask me if you, again, are a federal worker or were impacted by the federal workforce reduction about fee waivers and deadline extensions, because the grad school has been rolling out some of those and you may be eligible for our program. For everyone else, though, April 1st, application fee of $90, and everyone will begin at the same time, which is August of 2025, where we start our summer intensive session. Very exciting. But we do keep that virtual, so you have a little extra time to kind of coordinate travel to the area. Also keep in mind, try to apply for fall 2025 when you submit your application. Even though August may seem like the summer, our kind of summer session is actually called a pre-fall session. So note that we count it as within the fall semester, even though it starts a bit before the typical fall term for Georgetown. And finally, as Dr. Myers hinted to earlier, let's talk about financial aid and funding your degree. So this program offers limited merit-based scholarships. We really encourage applicants to apply the earlier the better, so they can get full aid consideration as we kind of start allocating our budget as we go through the cycle. But we definitely still have aid packages available. Typically, this is no more than 30% of tuition, and this applies just to tuition, not housing or board or anything like that. If you are curious about kind of finding housing in the DC area, though, I also have some great resources on that. A lot of students really find help with the Office of Graduate Fellowships and Scholarships, which has resources for MS-specific fellowships, scholarships, and other external funding sources. They have some tips on how to apply to them, typical deadlines, and some kind of typical recurring fellowships and scholarships that students should look into. I can definitely provide more links to that myself as well. If you are planning on continuing employment through the program, we also really recommend reaching out to your employer, seeing if they have any tuition benefits that you can apply to this program. If you're eligible for Veterans Affairs benefits, we also have the Office of GU Veteran Service, which can provide more information on starting the application process for those scholarships and loans. And they also have a great website and offer virtual appointments. The free application for federal student aid is open as well for this admissions cycle. And that we really recommend students apply to because graduate students are eligible. It is free to fill out, and you could be found eligible for federal low interest student loans or federal work study status. Even if you don't have specific federal work study status, you're welcome to apply to jobs on campus. There's a lot of different opportunities across the graduate school as well as other Georgetown schools. We're on the Hilltop campus, so anything on main campus would probably be nice and easy for you to commute to between classes. And that can also be a great opportunity to get some experience in other areas you want to specialize in public health, or just kind of see what other programs are up to. For example, we have a student working with our program right now in our social media and marketing who is from the Environmental Sustainability and Management program. So it's been great to kind of get her perspective on the environment and health and how that relates to our program. There's also a lot of research assistant and teaching assistant positions available off campus. These positions you can work to for up to 20 hours per week while pursuing study at Georgetown. And finally, the Georgetown Office of Revenue and Receivables, which handles billing for the university, offers monthly installment payment plans for tuition. So if you're interested in that, you can just opt in through the typical billing portal when you're setting up tuition payments for Georgetown. I also have some international scholars specific information. So again, I can send you a bunch of links for this if you happen to be interested. All right, so again, thank you so much. I know we've done a lot of talking today, but we really appreciate you sitting with us and learning with us about our program. So, of course, I want to open up now for plenty of questions from you. You're welcome to type in the chat, go off of mute, or use the raise hand function, and any of us are welcome to help out. I see one of them in the chat right now. First of all, someone has asked that the NIH has recently scaled back funding for many programs. Has our program traditionally received NIH funding? And if so, do we anticipate any impact on admissions or resources?
So I think I should address that. First of all, our program doesn't directly receive any government funding, so there should be little or no effect on the program per se. Some of our instructors might be affected as far as their positions or labs, but so far we haven't seen any changes in what we're doing coming up, and I really don't anticipate anything major. As far as NIH, yes, NIH is being affected. A lot of what's going on in the federal government is sort of up in the air right now. It's back and forth, and what I would suggest is that going to graduate school in times of uncertainty is a good way to advance, to get more credentials and get stronger in a field and maybe avoid the early job market for some period. So that's my personal advice. We're not being affected directly. So the second question is about the self-reported GPA. So you can use the calculator that the graduate school provides. You can also list the GPA that's on your transcript. However, different schools calculate GPAs different ways, so the graduate school will ultimately verify any GPA that they look at that looks like it's not consistent with the way that they calculate. Um, Oftentimes there's not much difference between those two numbers. So I really wouldn't worry about it. As Jennifer said, we look at applications holistically, and the difference between a 3.35 and a 3.1, which, might be something that could occur because of different ways of calculating, isn't of concern to us. And if you fall a little bit on one side of the 3.0 or the other, if you present a great application, we'll look at the whole thing and make a decision based on that analysis. So, Sophia, do you want to ask a question? Sophie, rather?
Hi. Um, Thank you all so much for your time too. And Jennifer, I know I've been in contact with you a bunch, so I just have two quick questions. The first, you kind of mentioned it, so the cohorts, that's like the size of the accepted students, so it is small, so it's like 15 or so students in your entire program.
I mean, yes, it's usually been about 16 students, including part-time students. So usually it's been somewhere around 12 full-time and 4 part-time. Like the last year, I think it was smaller. It was smaller than that, but about the same ratio of full-time to part-time.
Okay, thank you.
So very small.
Yeah, really, really intimate. I like that. And then my second question, my main concern obviously is the cost of tuition. So I'm definitely interested in pursuing like a work study, either research assistant or teacher's assistant. But I did want to know, like before putting the deposit down, if work study positions are guaranteed for all students who apply, or if it's like really competitive and not something that everyone can obtain.
That's a good question. So for working positions across campus, there are a lot of them. So I think it depends on the department that's offering them, how competitive they are. But I think there are a good amount of opportunities across Georgetown just because there's so many different kind of schools and departments looking to get things done. So there's usually things cropping up. I work with a lot of the other interdisciplinary programs, program coordinators. And usually most of us will be adding some sort of student assistant to our work each year. Like I'll be hiring again next year once my current student worker graduates in May, which is exciting. So I think it depends on the department, the competitiveness, but also there's not really a limited, very small type pool for work positions on campus.
Okay.
We don't have teaching assistant kinds of things available because our classes are so small. So it's like our classes don't have teaching assistants. but I think there's other there's other work study opportunities that are available for grad students, right, Jenny?
Yes, to
Yeah.
clarify, TA and RA positions are
Oh,
not within
okay.
our program,
Mhm.
but we have other ones on campus for other graduate programs.
Okay.
Or to put it another way, our students can get jobs that are associated with other graduate or undergraduate programs. I also want to say that you may not be able to work in the research or educational program that you want to, but I can tell you this, that if you're eligible for work study, um, every year I see some work study jobs um, go unclaimed. So I don't think there's any paucity of opportunities if you're willing to take on a variety of types of jobs.
Yeah, I've never heard anyone say, "Oh, it was so competitive, I couldn't get one."
Okay. Okay, that's great. It's good to know because that like, I definitely need to get one. So that clarifies that.
Yep.
Thank you so much.
No problem, and congratulations on your
Oh,
admission.
thank you.
Sophie's already been accepted.
I'm so excited. I'm so happy, but I need to coordinate with you more, Jennifer, about like getting figuring out the work study part. But super,
Yeah, of
super
course.
excited. Thank you.
Yeah, feel free to reach out. Awesome. All right. Well, anyone else, if you have any other questions, you are again welcome to type in the chat, go off of mute, or use the raise hand function.
Yeah, I did have a question. Um, so I guess my question, well, I have a few. My question was for part-time. Would that be like a virtual or in person?
In person.
So, yeah.
In person.
Yeah,
And then
the
I,
only virtual course is well, there's two virtual courses. So the semester starts with a virtual course. The 3 week summer course, end of summer course, is virtual. So we do that so students have more time to, move to DC if they want, or take the course from somewhere else if they want. And the seminar course is virtual. But other than that, all the classes are in person.
okay. I also had another question too, because you were saying if somebody already took the biology courses, then we can take an elective. So I guess I had a question because I really like epidemiology. Would you guys substitute a course like that, or would it have to be some sort of health biology course that's equivalent?
No, well, you can substitute any approved elective or any elective that we approve.
Hmm.
For EPI, I'd want to have a conversation with you because there's a required course um, that covers EPI, right? So we wouldn't want you to take two courses that were too
Yeah,
similar. But if you wanted to take an EPI course that was different than the EPI course that we have, that would be fine.
awesome. Yeah, because I haven't like decided like what focus I wanted to do yet. Because for me, I like nonprofit, I like epi, and then there's just like the general MPH. So I guess I'm trying to figure out like what my focus would be. So that's why I attended the seminar just to kind of figure out what the university offers and then just to figure out my focus. But you were saying there's like a policy for the epi, like I have to take a course before that. Um, like what would that include? Like,
Well, that's actually a difficult question to answer right at the moment because we're changing EPI instructors. So the first, so in the fall, there's a theory and methods of epidemiology course, and in the past, it's been kind of, it's a pretty basic introduction to epidemiology. So it covers clinical trials and it doesn't have any heavy statistics in it. Like you don't have to learn computer program kinds of things, but you will learn about p-values and confidence intervals and randomization and blinding and how to design some basic clinical trial design, but also really how to read the medical literature and assess it in a critical way. So that's the quantitative part of our theory and methods course, and then in the spring you'd be learning more qualitative methods under Pam Saunders. But so it's kind of an epi light course, if you will. And if you wanted to take another um, more intensive epi course, that would probably be approved. But right now we're trying to decide who should be teaching the epi course, and it might change some depending on who's going to teach it, because people put their own stamp on it. So a little hard to answer.
Relevant to what you said, I think it was Rachel, right? About exploring more about what you want to do in the health space professionally. We have a number of related programs at Georgetown, and those include the Global Health Program and the Global Infectious Diseases Program, and a number of our students have taken electives in those programs to learn more about things such as specific about zoonotic diseases or
Yeah.
other things like that. So, Dr. Furberman mentioned that MD courses are not part of what students can take in this program, but what you can take also is a wide variety of biomedical sciences courses if we approve them. And so those global infectious disease courses, et cetera, are part of that constellation.
Yeah, no, because well, a little bit about me. I've always done dental hygiene. So my field that I'm in currently is dental hygiene. So I was thinking something like epidemiology of microbial disease. And right now, with everything public health, I was thinking also maybe health policy. So I'm kind of debating between the two because I love being an advocate, but I
Right.
also want to learn a little bit more about microbial disease. So just kind of blending it in within the dental hygiene path a little bit.
Yeah, that's great. So, I mean, you're going to learn about advocacy in our program whether you want to or not. So, the thing is that, yeah, you have probably for you, you have three electives, is my guess. If you have a education that involves some basic biology and anatomy and you know something about diseases, you could readily have three electives and take a number of courses that are related to infectious diseases or policy, et cetera.
And Sarah put in the chat that there's a cool infectious disease policy course, but there's a bunch of infectious disease courses. So yeah, I mean, yeah.
Yeah, I know
Yeah,
that sounds
so
great.
we mentioned seminars, and the seminar coming up on April 9th, I don't have a title yet, but it's likely to include some element of infectious disease policy, is my guess, and we're still working on that. So you might want to think of dropping in on that.
Awesome. Thank you guys so much.
Sure,
Sure.
you're welcome. Thanks for coming.
All right,
Um,
we've come to the end of our time, so I'll put up our contact card. But if any more questions come up, you're more than welcome to reach out to our program. I put up our program phone as well as our program email, which is HAPI or happy@georgetown.edu. We also really recommend looking at our social media for updates on new seminars that are coming up, as well as events. We have an Admitted Students Day in person on campus on March 28th, next Friday. So hopefully we'll see some familiar faces there. We're really excited to celebrate all the admits. And feel free to reach out again if anything comes up, you have any other questions about the program, or just kind of want to share your passions. We really appreciate you joining us today, and we hope you have a great rest of your day.
Thanks so much.
Thank you so much.
Take care,
Thank you
everyone.
so much.